drinks to better control your blood glucose levels. So this video is for you if you're diabetic, pre-diabetic, or if you want to take better care of your health. These drinks will help lower your blood sugar. And the last drink I'm going to tell you about is surprising because I'm sure many of you, including myself until recently, thought that this drink had the opposite effect. We thought it did just the opposite. I used to think this drink was bad for controlling blood sugar, but it's not. Several scientific studies have shown the opposite, that it can greatly help both diabetic and pre-diabetic patients. So folks, this video is essential for those of you who want to better manage your blood sugar levels. Before we begin, go ahead and leave a comment telling me which part of Brazil or the world you're watching from right now. I'm here in Rio de Janeiro, Brazil. And you, where are you? Is it in Rio Grande do Sul, São Paulo, Minas Gerais, the Northeast, North, or Midwest? Is it in Portugal, Angola, or the United States? Let me know right in the chat, leave a comment, and also tell me if you have diabetes or pre-diabetes because I want to get to know you better. And grab a pen and paper, folks, because our first drink we're discussing is green tea. Why does green tea help control diabetes? It contains substances called polyphenols, particularly epigallocatechin 3-gallate, which we'll refer to as EGCG here. And this catechin has antioxidant and anti-inflammatory properties, which improves insulin sensitivity, increasing glucose uptake by cells. So how does this work? Let's break it down. Insulin is a hormone that, among other functions, stimulates the cells in our body to absorb glucose molecules or sugar molecules from our blood. If our cells are sensitive to insulin, this uptake will occur perfectly in an adequate manner. However, if our cells are resistant to insulin, they won't react. They won't respond to the insulin stimulus to capture this sugar from the blood. So the blood will continue to have sugar with glucose accumulating. So when we're talking about pre-diabetes, diabetes, these are conditions where a person has high insulin resistance, and as a consequently having high insulin resistance, we also have low insulin sensitivity. Are you all understanding this well? If anyone doesn't understand, just ask, and I'll answer, okay? So when we're talking about diabetes, pre-diabetes, what do we want to do? We want to increase insulin sensitivity and at the same time, reduce insulin resistance. So you'll see that these drinks basically have these functions, have these effects. Green tea not only increases glucose uptake by cells, but the EGCG, epigallocatechin gallate in it, also inhibits the activity of two enzymes, alpha amylase and alpha glucosidase. These enzymes play a role in carbohydrate digestion. As a result, drinking green tea can help reduce glucose absorption in the intestines. Our next drink is cinnamon tea, which contains polyphenols and a substance called cinnamaldehyde. These compounds have an insulin-like effect, meaning they help glucose enter cells more easily. Cinnamon also boosts the activity of the glucose transporter protein GLUT4, which promotes of glucose by muscles and adipose tissue, which are our fat cells. Cinnamon tea also helps reduce blood sugar levels. For this reason, if someone is taking metformin, a common diabetes medication, or any other anti-diabetic drug, they need to be careful with cinnamon tea because it can significantly lower blood glucose and cause hypoglycemia, which is something we want to avoid. The next drink is ginger tea, which contains gingerol that improves insulin sensitivity. Ginger also reduces liver glucose production, mainly by increasing the activity of an enzyme called glucokinase, and lowers blood sugar levels. The next drink is apple cider vinegar, and this one is amazing. Why? Besides containing acetic acid, which slows down stomach emptying and reduces the glycemic response after meals, it lowers glucose spikes, those sugar peaks that occur after eating. Apple cider vinegar also increases insulin sensitivity in muscles and fat tissue, and it also lowers the glycemic index of foods. So for example, if you eat a piece of bread, what will happen to your blood sugar? It will rise, which is normal and expected. However, if you eat bread and drink apple cider vinegar with it, your blood sugar won't spike as much because it reduces the glycemic index of the food, and the glycemic index is the rate at which food can cause changes in the body's blood glucose levels. So, apple cider vinegar is excellent for these reasons. Similarly, lemon juice, which contains citric acid, reduces glucose absorption in the intestines, slows down digestion, increases feelings of fullness, improves the function of insulin-producing cells, which are the beta cells located in our pancreas. And lemon juice also increases insulin sensitivity in peripheral tissues, such as muscles and fat tissue. Next up, let's talk about coconut water. Potassium, magnesium, and other electrolytes help control blood sugar levels. So coconut water can improve muscle function and metabolism, and as a result, it can also help regulate blood sugar levels. Hibiscus tea is rich in anthocyanins and flavonoids, which improve insulin sensitivity. It has antioxidant and anti-inflammatory properties, which are beneficial in addressing problems caused by high blood sugar levels. Both oxidative stress, which is combated by antioxidants, and inflammation, which is fought with anti-inflammatory substances, are consequences and also causes of diabetes. So by controlling these factors, we're also taking positive steps in the fight against diabetes. Hibiscus tea also increases levels of adiponectin, a hormone that influences glucose metabolism and insulin resistance. Next on our list is lemon balm tea, which contains polyphenols like rosmarinic acid and flavonoids, improves insulin sensitivity, facilitating glucose uptake by cells, lowering your blood sugar levels, and also has anti-inflammatory and antioxidant properties. What other herb containing rosmarinic acid can I take? How about rosemary tea? Well, just like lemon balm tea, rosemary tea is also a great option. Bay leaf tea and Indian clove tea are good choices too. All these teas will help and contribute positively to improving diabetes control. And now, folks, our first drink here, which I mentioned was a surprise for me and will also be a surprise for you. The drink that will help control your diabetes, and it's not just me saying this. Dr. João is speaking about several studies that have shown the effects of this drink on patients with diabetes. Once again, I'm not the one making these claims about beet juice. Numerous studies are reporting these findings. It contains nitrates that improve vascular function, increase blood flow to muscles, and consequently enhance glucose uptake. They observed, for instance, that those who consumed beet juice experienced a reduction in certain factors and markers indicating poor diabetic control, such as Roma A, Roma B, and Roma R. So, folks, beet juice has been shown to improve insulin sensitivity and contribute to lowering blood glucose levels. How much beet juice should you drink daily? I believe 150 milliliters is a good amount for you to consume. Of course, if you're diabetic, you need to carefully monitor any changes that beet juice might cause in your body. So it's possible that you might drink beet juice and react in a way we're not expecting. But it seems that most people with diabetes who consume beet juice actually benefit from this practice. Obviously, you can't add regular juice to it, and you should avoid adding honey, just like with all the other juices I mentioned here, coconut water and all the teas I talked about. You shouldn't add sugar, honey, or any other sweetening substance. Got it? Because otherwise, what's going to happen? Instead of lowering your blood sugar levels, it'll increase them. You can't add sugar, okay? Because if you do, we'll get exactly the opposite effect of what we want. Water will also help control your glucose levels. Look, besides these drinks, if you want to better control your diabetes, if you want to reduce the amount of medication you're taking, if you, as a diabetic, dream of one day, if you have the dream, desire, or goal to stop taking metformin to reduce your insulin use, if you're an insulin-dependent patient, it is indeed possible to do this with a healthy lifestyle. Choosing the right foods, doing proper physical activity, managing stress, sleeping well, all of these contribute to better or worse diabetes control. And I teach you how to do this in my book, The Longevity Code, Habits to Live Past 100. So if you want to learn scientifically proven strategies for natural control and reversal of diabetes, Click now on the first link in the description or on the pinned comment and get your copy of the longevity code right now for just $29.90. If you read the book and put into practice what's in it, I'm absolutely certain that your blood glucose control, your blood sugar control will improve significantly. And once again, it's not just me saying this. The strategies in the book are drawn from scientific studies, from thousands of scientific studies that prove what's written there. So, folks, click now on the first link in the description or on the pinned comment and get your longevity code right this moment for just $29.90 in the digital version.